Hello, my name is Dr. John Lapkass. I'm a board-certified orthopedic surgeon at Anchorage Fracture and Orthopedic Clinic, and I specialize in total joint reconstruction, arthroscopy, and sports medicine. In this video, I will be discussing hip arthroscopy. Hip arthroscopy is a procedure where doctors are able to perform procedures in the hip with the use of very small incisions that are only 3 or 4 millimeters in size. In most situations, surgical procedures that used to be performed with very large 8 to 15-inch incisions are now done through these minimally invasive procedures. Hip arthroscopy is most commonly performed for tears of the acetabular labrum. Other conditions we address arthroscopically are femoral acetabular impingement, loose bodies, cartilage lesions involving either the femoral head or the acetabulum. The ideal candidate for hip arthroscopy is a patient that has had symptoms including pain and catching in the groin, pain with rotational activities, and inability to perform sports activities despite having had conservative measures in the form of injections in the joint, physical therapy, and activity modification. The advantages of hip arthroscopy include the fact that most patients will come in, have the procedure, which takes about 3 hours, and then go home the same day. Patients are very active immediately postoperatively. They're on crutches typically for 3 weeks, starting rehabilitation immediately. This is as opposed to the typical open procedures where we actually do the procedure in the hospital. The patient has to stay several days, and they're limited in their ability to get around and really continue on with their day-to-day activities for quite some time. Once the patient is seen in the office, it's simply a matter of making the phone call or speaking directly to our practice coordinator. In those situations, the time will be found for the surgical procedure at the patient's convenience. Usually a patient is seen a day or two before the procedure, as well as to do a preoperative clinic visit to discuss any concerns that they may have regarding the surgical procedure. In most situations, the recovery process for the hip arthroscopy procedures includes about 6 weeks of limited activities. Patients will start physical therapy almost immediately. They are using crutches for 3 weeks, but working with physical therapy on motion to the hip. Most of the time, therapy happens twice a week for 6 to 12 weeks. Patients are encouraged to ride an exercise bike within the first few days following surgery. To learn more about hip arthroscopy, please visit our website at www.afoc.com.